Go.
Hey, this is Ron French again from the Shoulder and Hand Therapy Center in Paris, Tennessee. On the first video, I talked to you a little bit about carpal tunnel syndrome, and so today I'm going to talk to you about your decision to go ahead and have surgery, if that's what you've decided. Surgery isn't as complicated as a lot of surgeries. What the doctor will do is he will take you in the operating room, prep you, do all that stuff, and the basic surgery means cutting through that transverse carpal ligament that we talked about. And then they will kind of open that up, and that relieves all that pressure in there. Most of the time that's enough. Sometimes the doc will have to go in a little deeper if he thinks the nerve may be impinged and try to get it unimpinged before he closes you back up. He's going to sew you back up, and you're going to have a little scar right here, about an inch or inch and a quarter, and he'll have stitches in it. Usually you'll be bandaged pretty good for the first 3-4 days, and then the doc will take the bandages off. You'll still have your stitches, but at that point you really need to start your exercises. Remember from the first video that there's lots of tendons running through this carpal tunnel, and we don't want them to get caught up in some scarring or anything. We want them to keep moving through here, so the fingers keep moving through here. And so just some basic exercises, and you're going to start off doing these. Do 3 to 5 of them at a time and let pain kind of be your guide. I do them 2 or 3 times a day just to make sure everything stays loose and limber. So the first exercise I like people to start off with is starting with a straight fist, just like this. You're going to curl that up into a regular fist. Then you're going to curl them up into a claw, straighten them out, pull the wrist back. Okay, let me do that one more time for you. You'll start with a straight fist, curl into a regular fist, up into a claw, and straight up, straight back. Okay, as you do this, you're pulling these tendons through this carpal tunnel, and we want those to keep gliding through there, so that's an important exercise. The next exercise I want you to worry about is being able to oppose your thumb, and what that means is bringing your thumb across your palm. So you'll start off by touching the tips of each finger. Now you may find you'll only get to the middle finger or maybe your ring finger in the beginning, and that's okay. Just keep trying for the next one. Keep trying, and eventually you'll get there. You need to be able to oppose. And the third exercise is what we call a rooftop, what I call a rooftop exercise. You're going to start with your fingers straight. You're going to straighten them, keep them straight, and bend them just at the knuckles, just like this, making a rooftop. Then bring them back, stretch your wrist back. Okay? Rooftop, up, back. These are the 3 basic exercises I would start off with right away. Now after about 10 days or so, the doc's going to take the stitches out. And then there'll be some other issues that you'll need to talk about with your doctor or your therapist. However, just be gentle. When they take your stitches out, they're going to put some steri strips on there if it's open at all, and most of them are. Leave the steri strips on until they fall off, because we want that wound to be healed. If you're diabetic, it's going to take a little longer. If you're a smoker, it's going to take a little longer. If you don't eat a good diet, it's going to take a little longer. So remember all those things that you already know. And so your wound, you want your wound to heal quickly, and you want it to scar properly. You don't want scarring grabbing those tendons. You don't want scarring holding your skin down. And I'm going to talk to you about that in the next video, just a little bit about how to take care of the scarring and how to go ahead and advance your exercise program. So this is Ron French from Paris, Tennessee. Have a great day.